I think that what the doctor does on the day-to-day in the office, the online community now allows them an opportunity to do the exact same thing, but in a different setting. It's just a setting maybe that you're not as comfortable with. But if it works in the office and in the community, chances are it's going to work in the virtual community as well. And so putting yourself out there, that's how you're going to create that relationship, not just with women in general who are the healthcare decision makers, but with everybody in general. And that's how you're going to build your practice. And the data supports it as we look at these consumer trends in healthcare and the decision-making process. The data supports what we're talking about. So now's a great time to get out there and try it for yourself.
Meet your patients where they are.
Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I am Jennifer.
And today we're going to talk about an issue which I think is relevant for this conversation. That is, we're going to talk about how consumer health trends online have changed, specifically as it relates to women. One from the side of women's health. So if you're a women's health practice, an IVF practice, something of that nature, this really applies to you. But also from the side of females being the main decision makers when it comes to healthcare decisions in the household. And so there's a consumer trends report that just recently came out talking about this evolution of how people are finding healthcare information, making decisions related to healthcare online. And so that's what we're going to dive into.
Exactly, Jen. So, as we look at this as a whole, what are some of the main things you think are really taking this conversation to a new level and have really evolved over the past 5 years?
Yeah, so there's a lot of things that have evolved, but one is there's kind of this increase in engagement and an openness in terms of what you're finding online. In fact, there's more discussions around women's health and women's health topics by about 6% in the last year, meaning women are going online to find information about bioidenticals, about hormone replacement, about menopause, about PCOS, about sexually transmitted diseases, you name it. They're more likely to go online and be looking for this information at this point.
Well, and I think with all of the different social media channels out there right now and everything really being a video conversation with their audience, look at TikTok. You can go into TikTok and search pretty much anything, whether it's hormone replacement, what's the difference between synthetic and non-synthetic bioidenticals, you can pretty much look up any of that and a slew of videos will come up, not only just regular women, but talking about their symptoms, but you'll get actual MDs online talking about these symptoms, what's causing these symptoms, and what some of the treatments are.
Well, I think it just shows that the trend is shifting towards more acceptability as it relates to transparency, and people are less likely to have walls up and only talk to their doctor. Now individuals, really women, are looking for that health information online. You've got this dichotomy right here of, I'm wearing my reading glasses because I can't see without them. Taggart's got her reading glasses off because
I can't see far away.
She can't see far away. But the fact is now more and more individuals like us are looking for this information online. When was the last time, you don't probably watch regular TV like I do as much.
Yes, I do.
But I have noticed they're now feeding me, the taboos are gone because now it's adult diapers, it's all over body wash and body sprays now, and we're like deodorant for all your parts and not just your underarms.
Well, honestly, the subscription model has changed everything. Last night I was getting ready to watch the Bills game. Yes, Bills Mafia. And it asked me before the game started, did I like Reese's or did I like Kit Kat? And
I like them both.
Right, that's what I said, or both. But when you pick, it then fed you ads all throughout the game geared
That's pretty
on
cool.
Reese's.
That's pretty cool.
And that's happened a number of times where, you'll see something to where, do you want this prescription drug or this prescription drug? And it will feed you that type of content on the subscription TV channels, which is crazy.
That's interesting. So the next kind of evolving trend that this report has pointed out is it's no longer about searching for things and for information from a standpoint of like a broad search. Women's health, that's not the way that you want to approach it. It's specific disease states or categories that you're looking up. Endometriosis has increased from a search standpoint almost 30% in the last year. So that tells you, as you're looking at what kind of information that you want to put out there from your website standpoint, from your videos maybe on TikTok or Instagram or whatever, you want to really dive into the specific conditions so that you can really hit that when those women or any of your potential audience are searching for them.
I'll add it to that just a little more. I think people have gotten so much into searching their symptoms, and as they're searching their symptoms, they're getting kind of what the diagnosis might be, and then they start searching that. So, I mean, I will say this, 5 years ago, I didn't even know what PCOS it was. I didn't even have a clue. It wasn't something that was talked about. But the more people started getting out there and asking about these symptoms and things that they have and talking about it more openly, you know, all of these different, like you said, taboo type, diagnoses are coming out just from searching symptoms.
Well, I think one of the things, so we'll go back to the idea of this transparency and this engagement and how it's on the rise. And so it's specific topics, so let's go back to endometriosis. 23% increase in the times of engagement related to endometriosis. That is people having real discussions within social media channels around a particular topic. The data suggests that 87% of the individuals participating in those discussions are dissatisfied with the information that they're finding online because people don't know if it's real, if it's something they can trust. And so if your medical practice and your doctors are the experts on this, you can fill that gap and that void of that 87% of dissatisfied patients just by providing real-time information.
Absolutely. And again, it's that talking and relating to the patients as it relates to their symptoms and what they're feeling and explaining to them and educating them, through social is important.
So let's talk about what healthcare brands might be able to do to support women's health in meaningful ways. And I say this again, it's not just women's health. Look at it through the lens of the idea that women are the healthcare decision makers. And so we want to support women in their decision-making process as much as we want to support women in their healthcare needs. But the very first thing that I think a practice can do is be consistent and empathetic in the way that they're putting out their content. Don't just focus around PCOS month, focus around a deeper dive into the topic. And let's, rather than just focus on Fertility Awareness Week, let's focus on some of the myths that we want to overcome related to fertility or something like that. We want to provide authentic and consistent information to our folks.
Absolutely. And you really want to talk to your age group. If you're going to talk about a specific topic, talk to that age group. You can do the same information in two different deliveries. Two different ways of giving that same information, but talking to that younger audience, maybe that 20 to 40 age range, and is going to be a different tone and a different style than talking to that 60 plus age range that needs their glasses.
Are you 60 plus?
No, I am not.
Well, she said it, not me. She said it, not me, but I think you're hitting the nail on the head. Like the TikTok audience, well, no, I'll even take that back because older folks are on TikTok. The older audience, the boomers, it's a very different message and it's very different what you're talking about versus the young girl who is just starting her decision-making journey.
Exactly. I don't remember as a child being nervous to go to my first OBGYN appointment. Now, because there's so much information out there, these girls have a preconceived notion of what that first appointment is going to be like, and getting on and talking to that younger audience and explaining to them that it doesn't always have to be this big, scary event in your life. So I really do think tailoring your message to your audience. It doesn't even have to be.
It could be
one social
orthopedic.
channel.
It could
Right,
be,
exactly.
It could be fertility.
Exactly.
It could be orthopedic. It could be hearing aids, it doesn't matter what it is. I think the message here is you want to tailor your audience, tailor your message to the right audience.
Right.
Another thing you want to do is really consider fostering engagement in online communities. And what I mean by that is we've historically said you want to put together a video. You want to get the information out there. You want to put it on your channels. You want to go, you want to get it out there. But the reality is a two-way dialogue will go much further in building that trust and creating that level of engagement. I'm not saying you have to answer every direct message that comes at you, but maybe there's an opportunity, whether it's a live event or a time where you do get on, doctor, and you answer some specific things, or you address things, or you dispel myths maybe that you're hearing about, because that will tie back to your profiles, back to your website, and will do better for you all around.
I totally agree with that. I also agree I also think that there are mommy groups. There are online mommy chats where you do a Facebook Live or a TikTok Live or any kind of live event where you're attracting that particular segment of women. New Mommies is one. I was just happened to bounce on TikTok the other afternoon at lunch, and there was a mommy group, and there were 780 participants in this live, and they were just talking. They were just talking about how they felt. Did they have postpartum depression? How did they deal with it? Where did they go? Who did they talk to? 700 women from all over the country. Now, is this going to make a difference in your day-to-day practice? Maybe, maybe not. But if you can look at that audience and hear what they're saying and look at the topics and the things that they're talking about, that's where you can really hone in and really create a message directly to them.
So to keep it along the vein of women's health here, so a couple weeks ago, I don't know how I got suckered into doing it, but I got suckered into hosting a live webinar with a large women's health clinic. And so the doctor, let's call her Dr. T, doctor was she was kind of the main host on the webinar, and they're doing skincare treatments as an ancillary as part of their women's health practice. And she was very nervous, and so we were in there doing it, and I said, hey, Dr. T, you've got like 80 people that are participating. And she wanted to just cut off and not have any kind of open discussion. But all these folks got online and wanted to have a conversation with the doctor and with the reps from the company. And they had quite the dialogue. The dialogue itself was almost as interesting, if not more interesting, than the webinar itself. But that dialogue created a trust factor. And then fast forward, a week later, they used that webinar as a jumping off point for an in-house open house event. Jen and I flew up to the practice to spend some time with them for the open house, and people who had attended the webinar actually came to the open house to make the purchase, cash-based purchase, ancillary services, $1,200 per pop, and they were selling them left and right because the webinar was about hormones and skin changes, and they've got the equipment to help address the skin changes. And it was a great moneymaker for the practice. It was great branding for the practice, and it created some affinity with individuals in the community who they wouldn't have been able to build those relationships with.
I think the bottom line is become an advocate for their healthcare, for their wellness, listening, caring, like you said, building that trust in whatever way you can do that by inserting yourself in their conversations.
I think you just nailed it. And let's wrap up here. I think that what the doctor does on the day-to-day in the office, the online community now allows them an opportunity to do the exact same thing, but in a different setting. It's just a setting maybe that you're not as comfortable with. But if it works in the office and in the community, chances are it's going to work in the virtual community as well. And so putting yourself out there, that's how you're going to create that relationship, not just with women in general who are the healthcare decision makers, but with everybody in general. And that's how you're going to build your practice. And the data supports it as we look at these consumer trends in healthcare and the decision-making process. The data supports what we're talking about. So now's a great time to get out there and try it for yourself.
Meet your patients where they are.
So with that, I'm Jennifer.
And I am Jennifer.
And we'll see you next time on the Dr. Marketing Tips Show. Thanks a bunch.
Bye.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.